Welcome to Face It, the Aesthetics Podcast. Today I have Dr. Arun and his patient Ciara. We are talking all things educational. We are going to talk about Ciara's journey through her issues that she had. She came to see Dr. Arun, and he is going to talk through his process and how he was able to treat Ciara as his patient. Dr. Arun, how are we feeling first and foremost today?
I'm good, bit tired. It's been a long week, as usual.
And Ciara, Dr. Arun asked you to come here, but you didn't realise it was going to be videoed.
No, I did not.
So just in case you said she would have came a little bit more made up, but it's all grand. Okay, so you found Dr. Arun. How long have you known Dr. Arun?
Probably 6 months now, maybe more.
And how did you research and how did you come to know?
I actually, I didn't research initially, but a friend had attended his clinic and recommended it. I would be rather sceptical person myself, so before I did anything, I did do a bit of research and background into Dr. Arun. I was happy with what I found, and I attended one of his clinics.
Okay,
first time hearing of this.
Do you want me to be honest?
Yeah, absolutely. Let's talk about a bit of your background. So have you had any injectables before, just to sort of know, or was this your first time experience in aesthetic procedures?
It is, yeah.
It was.
It is. Now, I would look after my skin anyway.
Mm-hmm.
I'm a nurse by background as well.
Okay.
But injectables, no. And I was very, very sceptical of the efficacy of them. And
That's right. And that's why you seeked out a medical professional.
I did, yeah.
Okay. And what was your main issues that you wanted dealt with?
Well, when I went to Dr. Arun this time, I had been suffering headaches on a daily basis my entire life.
Mm-hmm.
Now, I am waiting to see neurology. I'm still waiting on that appointment. But my headaches had been so severe that my GP actually, I was on analgesics 3 times a day, supposed to take them. They were too strong. I couldn't take those 3 times a day.
When you say headaches, because people experience headaches in different ways, what was the sort of headache you were having?
Just chronic headaches. They were all over. We couldn't, I would have migraines as well.
Yeah, so coming from the sort of front end and then the back.
Yeah, round the side. The migraines were so severe that you would just be on the bathroom floor.
And how often were you getting the migraines?
Migraines weren't too often. It had been over a year since I had a migraine.
Mm-hmm.
But the chronic headaches, I used to get up in the morning, first thing.
Yeah.
Headache.
And you just had no
tried the
idea.
Pillows, tried everything.
What was...
No.
And you just needed some sort. So what made you say, I'm going to seek out aesthetics to see if they can help?
I did a bit of research into headaches, backgrounds for headaches, and what works for headaches.
Mm-hmm.
And the reason I went to Dr. Arun then, and I talked to him around this, was I had found a piece of research on the treatment that I had wanted and thought would work.
Yeah.
And I talked to Dr. Arun around that treatment, and at that stage, I wasn't sure that he was able to provide that, but he was.
Mm-hmm. So, Arun, what treatment are we talking about? Can you go into the depths of the consultation and what was prescribed?
So, yeah, firstly, as Ciara had mentioned, she was a patient of mine for other treatments beforehand. And then she'd brought into the topic of conversation during one of her reviews about her headaches. Mm-hmm. And I found that quite interesting because we have treatments for headaches as well as neck pain. And we kind of delved into her history of her headaches, what the causes were, what she had tried already, other conservative measures such as alcohol, smoking, chocolate, getting enough sleep in terms of more the neurological causes of headaches. So we had a very thorough consultation, and after talking to her about botulinum toxin, and we're using this in the podcast today more of in an educational manner to really say why we have done this. So essentially botulinum toxin relaxes the muscle. So in Ciara's case, when she came to me, she had very tense muscles in the neck. She had very tense masseter muscles, which is just around the back of your jawline, and her temporalis muscle. Because she had already been to me for treatments beforehand with regards to a very common botulinum toxin injections for the frontalis muscle, that's not something that we had to treat on this occasion. So after a thorough consultation and explaining the risks of such procedures, she came back for her review or for her treatment day, where we treated and targeted those muscles with botulinum toxin. So more in depth with regards to the procedure. We looked at specific pressure points within her neck area. We looked at the ability and the bulk of the muscle in her masters, and also the tension she had in her temporalis. And I think you can agree, when I picked up the mirror and showed her, the amount of tension she had in those muscles was unbelievable. And I think there's only 2 patients I've seen to date with that amount of tension in those muscles. And so with regards to dose-wise, we initially, because she had already had her frontalis muscle treated, we didn't have to treat that, but we treated her masseter muscles with 25 units of botulinum toxin on each side. We then treated her temporalis muscles with 20 units, both sides. And then we then treated her neck, and we specifically targeted the trapezius muscle with 50 units on each side. So total combined dose of 150 to 200 units.
And I think it is really important to emphasise that because you did suffer the medical process and gone through the whole consultation process in order you were able to address the main issues.
The biggest thing when it comes to treating migraines and neck pain is that you rule out other causes, because I am not going to sit and treat patients that may have another neurological cause to these issues, because it's not going to work. So the best thing is that that process is eliminated, and after it's eliminated, you then do your consultation, and after a thorough consultation, you target and you find out, well, do you know what, is it the tension in these muscles that are causing her issues or his issues? And I think in Ciara's case it was.
And what was your experience after having the treatment?
Skepticism. Very skeptical. But Dr. Arun had said to me, look, it'll take time, take up to 2 weeks. But he says, right, after 3 days, I want a text. Let me know how you're getting on. So,
but that's so important to get that communication. Particularly after a treatment like that.
You feel like you're being supported, though. So, which is really important. It's different going to someone, getting a treatment, and that's you done. Where you go now? I've got, But I didn't feel like that, which was great. So
I think the biggest thing, the reason why I wanted a text after 3 days is, I hope you don't mind if I say,
not at all.
During the consultation process, after I actually talked to her about how this works and whether it would work and how long it would last, she broke down in tears because she couldn't believe that actually there could be something that could benefit and could help her. I actually felt so horrendous. So during the consult, it was just like, if there was any patient that this needed to work on, it was this patient.
But again, that comes back down to the consultation and how important it is to get to know your patient, to allow you to be vulnerable enough to express how this is affecting your life and that this is a serious issue and where the treatment is merited, that you can proceed to.
Well, I've had, I'm not going to say my age, but I've had decades where I've had a headache on a daily basis. I was prescribed epilepsy medication to manage them.
Wow.
I am now 3 weeks off all medications.
That's unreal.
Yeah.
That is unreal. And no headaches at all?
No headaches at all.
Wow. And how has it changed? Obviously, with the headaches, how else has it?
Well, I was talking to someone even just before this, and every day I'm still waiting on this headache. Like, I still carry medication, analgesics, like they're prescribed analgesics, so you can't buy them over the counter. I still carry them in my bag just in case.
Yeah.
So I'm still waiting on the headache, but I don't have a headache anymore.
Even if you do, you always have Arun at the other end of the call.
Well, don't wait. Don't think about it. Just go and enjoy your life.
Yeah.
And don't be
Yeah,
waiting.
it's probably just because it's like I've had 40 odd years of it.
I know.
So it's just taking that wee bit of time just to adjust now to being pain free. Like all the medication under the sun, buying neck pillow after neck pillow to see what would work. And Dr. Arun has just changed my life.
But that's it. But talking, you are highly skilled and you have had the training and you have went worldwide to get the training. What would you recommend to those practitioners who are new into the industry to be able to provide the same patient care in the consultations and provide these treatments to them?
Well, consultations and actually injectable treatments were 2 different types of training. So, like, improving your consultation skills, it just comes with that continuous patient contact. And if you don't have that in your practice, then practice with family and friends. It's completely free to do so. If you're in the NHS, you obviously get that continuous professional and patient contact continuously. So that's why I think I'm good. I believe I'm good in my consultation skills because I'm still working in the NHS. I'm still having that patient-to-patient contact. So what my advice is, just continue practicing your consultation skills. Try and empathise with that patient. Try and find out what their key concern is. Try and find out what they're trying to achieve from their aesthetic outcome. And don't over-deliver. Don't overpromise, and making sure you explain the risks and the benefits of all the procedures. Like with Ciara, I said to her, look, I can't guarantee that this is going to work, but following your consultation, I can tell, looking at the face, there is areas of the face where you're super, super tense, particularly her temporalis muscle and her masseter muscle. So in my eyes, I was confident enough that it would work, but I didn't want to over-deliver, especially in Ciara's case, because she's been suffering from this for 40 years. Yeah. And it meant a lot to her. With regards to injections and injectable procedures, just continue courses, go travel, try and find out who's the best in teaching. Like I've had many mentors, especially throughout the last 12 months, being Dr. Tapan, Dr. Potter, Dr. Swift, and I've had the opportunity to sit loads of cadaver courses. I'm actually flying to Vienna on Thursday night with Chroma, doing a cadaver course there, where we're looking at the anatomy of the face. So just continuing your professional development, never stop.
Yeah, completely. Brilliant. Well, thank you so much, Ciara, for coming in and telling us your story and your review of Dr. Arun and how fabulous he is.
Yeah.
Stay tuned for the next episode in our educational series.